Thank you very much. Assalamu alaikum, everyone, and thank you for joining us this morning. I'll be extremely grateful if you could all please mute your mic if you are not speaking. So thank you for joining us today in the UpSign annual virtual event for 2020. And today is the day 2 in which our focus is talking about healthcare challenges, and the title of today's webinar, you call it, session, you call it, is Developing Future Healthcare Workforce in Pakistan. So I welcome you all into this session, and I am hoping that we are going to have a very lively discussion about healthcare challenges that we are facing in Pakistan and what is it that we can do. The idea behind this particular webinar is that we are able to talk about various challenges, for example, various opportunities and challenges which are associated with upskilling healthcare workforce, be it any of the healthcare workforce members. And we are particularly interested in talking about educational challenges faced by Pakistan's healthcare professionals, which includes doctors, nurses, midwives, occupational therapists, physiotherapists, and you name it, and it's included into the list. We also would like to explore the role of the diaspora in supporting healthcare workforce education and training, and what opportunities are available for Pakistani healthcare professionals in home and abroad, and how can we strengthen the links. My name is Paveen Ali, and I work at the University of Sheffield as senior lecturer, as well as Deputy Director of Research and Innovation for Health Sciences School. And I am also co-lead for the health team of the UpSign. So Jawad, you're going to put up a video, a little bit video about UpSign, isn't it? So for any of you who are new, I would suggest please do check our website and to understand a little bit more about UpSign and what various streams that we have. Our aim is to bring professionals, especially those in Pakistan as well as in the UK, especially academics working in various different diverse fields, bring them together with an aim to develop collaborations and with an aim to help people, help professionals, help academics come up with different projects, different networks, different things to enable us development of the country in Pakistan, and to develop projects of mutual interest to UK as well as in Pakistan.
Assalamu alaikum. Ladies and gentlemen and UpSign colleagues, I'm pleased to be here today to support the work of UpSign and how they are helping to link the scientific research and academic communities from the United Kingdom with the Pakistani counterparts and those that make policies. I apologize for not being able to attend this in person, but I welcome UpSign and their work towards greater collaboration around initiatives between key stakeholders from both the UK and Pakistan in the domains of health and science, as well as education. I'm delighted to send this message, wishing UpSign and its partners the best of luck towards organizing this annual conference, which is being held virtually this year. I look forward to receiving the recommendations of the conference, and my ministry and my colleagues will be available to support relevant opportunities for bilateral United Kingdom-Pakistan initiatives and cooperation in these areas. I would like to thank you all for the contribution that you have made so far and that you intend to make in building a better future for communities across these two countries. My best wishes to you for today and for your work. Thank you.
Assalamu alaikum and greetings from Islamabad. I'm delighted to send this message to all members and supporters of UpSign as it marks its annual conference. I had the privilege of meeting some of you at my house in March when you had held such successful meetings with senior figures in Pakistan, and I know you ran a series of excellent workshops. I think of 3 Ps when I talk about the bilateral relationship between the UK and Pakistan. The first is partnership, the deep partnership between our two countries, built on the strong people-to-people links and UK-Pakistani diaspora. The second is perceptions, how we help change perceptions of Pakistan to help it build more inclusive economic growth that can deliver jobs for a young population of 220 million people. And the third is potential, what I see as the huge potential for even deeper ties, more trade and investment. So I'm excited about Upsign's role in delivering that vision. Leveraging your fantastic links and knowledge can advance bilateral partnerships on education, healthcare and knowledge economy. This COVID-19 pandemic has understandably preoccupied us all, but I'm pleased that your endeavours and your ambitions have not been affected during this period. If anything, it has spurred you on. I'm confident that together we can take this agenda forward. Thank you for your time and commitment. My best wishes for a stimulating series of discussions, and I look forward to engaging further with you all. Pakistan और बतानविया के ताल्लुकात बहुत अहम और मजबूत हैं. UK-Pak दोस्ती.
Bismillahirrahmanirrahim. Dr. Khalid Mahmood Sahib, Upsign co-founder, Professor Jawad Dar, distinguished participants, ladies and gentlemen. Assalamu alaikum. I am Muhammad Ayub, Acting High Commissioner of Pakistan to the United Kingdom. I'm pleased to be part of the Upsign annual symposium. Upsign is a network of British Pakistanis aimed at addressing the socio-economic challenges of Pakistan and its diaspora through knowledge transfer. Pakistan High Commission is proud of its association with Upsign. The themes of this year's symposium, such as food security, developing future healthcare workers in Pakistan, knowledge transfer from Pakistani and UK universities, and skills and knowledge needed to prepare our students for international education, are most relevant to the future of Pakistan in the 21st century. The symposium will help foster new relationships and develop new networks aimed at solving Pakistan's development issues aligned with the United Nations Sustainable Development Goals. Pakistan has a long history of working in partnership with its UK-based diaspora. We appreciate Upsign's efforts to facilitate British scientists to partner with Pakistani scientific community for mutual benefit of our two countries. Earlier this year, Upsign took the initiative of organizing development workshops in Pakistan aimed at addressing the challenges linked to sustainable development. I look forward to hearing the recommendations of the speakers and participants on how best we can create opportunities for bilateral Pakistan-UK cooperation in education, science, technology, medicine, and in engineering. I thank you all.
So our first speaker is Dr. Shabnam Sarfraz, who is going to talk about healthcare challenges that we face COVID-19 in the context of COVID-19 and how we are working towards the achievement of sustainable development goals and what's happening around that. Dr. Shabnam Sarfraz is a member of Social Sectors and Devolution, Ministry of Planning, Development and Social Initiative. She is also a part of Women in Global, she's also lead for Women in Global Health at the Department of Global Health and Population, Harvard Global Health Institute. She's a senior development professional with 15 years of senior leadership experience, and she leads the National Sustainable Development Goals Initiative at the Planning Commission, and is also steering the National COVID-19 Secretariat, which serves as the conduit between the UN agencies and the Federal Planning Commission. Dr. Sarfraz holds a master's degree in management from Surrey University, UK, a bachelor's degree in medicine from Pakistan, postgraduate certification from Harvard University, LUMS McGill University, London School of Hygiene and Tropical Medicine, and Johns Hopkins University, and Queen's Margaret University, UK. She is amongst the 4 global health pioneers who were selected for the inaugural cohort of the Harvard Women in Global Health Lead Fellowship in 2019, and is currently also serving as a visiting scientist at the Harvard T.H. Chan School of Public Health. Thank you so much, Dr. Sarfraz, for joining us today and for your contribution. Over to you.
So thank you so much. I represent the government of Pakistan, where I work at the Planning Commission. So I'm going to be talking about the health workforce future today, but the context has changed with COVID, we all feel. I have 10 minutes during which I want to quickly talk about the paradigm shift of COVID-19 from being a catastrophe to an opportunity for policymakers, a little history of HRH and where we stand today, what did the state do to combat the pandemic, and what is the natural and optimal way forward for us and for you all. COVID-19, the catastrophe, the losses, but also the biggest opportunity for healthcare workforce in the past decade, at least, that's how I see it. In modern history, COVID-19 is the worst public health emergency with so much loss that we mourn together. Globally, this pandemic drew in support and appreciation for all those health workers putting themselves at risk to save other people's lives, working in extremely difficult circumstances across many societies. But the real question is, has this paved the way to seek explicit policies and practices to support health workers through the pandemic and further into the future? With the socioeconomic losses due to COVID, governments today realize this investment as pivotal for economic survival as well, not just Pakistan, but globally. As we move from the initial shock of the pandemic, the health workforce adaptations and practices required to sustain workers are more longer term than ever. And thankfully, the stakeholders are on board. COVID-19 made it impossible for policymakers to take out health workforce development from the equation. There is a growing understanding vis-a-vis achievement of SDGs and universal health coverage, revival of the healthcare systems, and building back better, all not possible without qualified and trained health workforce. Now, taking a few steps back into the past to see some context to the health workforce in Pakistan, I have been fortunate and to be associated with human resource health for slightly over a decade now, in technical assistance, advocacy, and lobbying, in different roles, private sector, public sector, as a consultant and advisor, and now at the Planning Commission as a policymaker. Around 2010, together, we had done substantial work for the nursing policy as part of the health policy being drafted at that time. We worked on health workforce planning, nursing production and absorption mismatch. The 18th Amendment and devolution of health pushed the workforce planning by years again, as provinces struggled to develop capacities for strategic thinking, policy making, a struggle which I would say they continue with to date. In the last 2 years, we have been trying to put our heads together with the WHO EMRO office, and we worked together with their experts and were able to develop the Human Resource for Health Strategic Framework for Punjab. And now we are working with them we are trying to come up with a national manpower plan for health. Some quick numbers to share with you. To achieve the universal health coverage, we need approximately 4 nurses to each doctor. On the other hand, Pakistan has 0.85 nurses to each doctor. This graph shows disparities in workforce strength by population requirements. To achieve the universal health coverage, we need to have 1 nurse per 290 population, whereas Pakistan has 1 nurse for 2,059 people. In other words, this is the extent of our shortfall here. In 1947, at its inception, Pakistan inherited 292 hospitals, 2 medical colleges, 48 doctors, and 186 nurses. Over these years, as the population has grown, so has the public health infrastructure, which is reflected in front of you. And I must say that a large percentage of our healthcare service delivery is supported by the private sector. The requirements for health workforce, of course, proportionately also increased. Then we have other transitions within our population, creation of appropriate training pockets, a critical agenda considering the spread of population and rural placement. Our challenges spanning from addressing the need of the pool of eligible candidates to their selection, quality of training and opportunities, followed by creation of appropriate working and specializing opportunities, and then of course, retaining them. Historically, the challenges in developing human resource for health have largely remained unchanged. Stakeholder commitment, pressing agendas, national circumstances, all demanding an HRH work plan along with simultaneous efforts for human development. Towards this end, we have been working together with WHO and their EMRO office. The COVID-19 Secretariat mentioned was established at the Federal Commission very early into the pandemic when our numbers were still in double digits, and is continuing to serve as a conduit between the ministries, provincial departments, and the UN partners for necessary technical backstopping. When COVID-19 set in, serious gaps were felt in trained and qualified human resource for health, losses, deployment challenges. The government has been working with academia, other institutions, and development partners for a coordinated national response. We immediately repurposed financing from existing projects, programs, and schemes at the Planning Commission, and $440 million were earmarked from within the government's funding towards COVID-19. Together in March, the Planning Commission approved an amount of $588 million, which was supported by the World Bank and the Asian Development Bank to mitigate the socioeconomic disruption associated with COVID-19 pandemic. We were able to plot population needs across the SDGs framework and build it into the national COVID-19 response, health workforce being one of the pivotal agendas. Throughout this response planning, we were conscious of the SDGs. Not only were they integrated into the annual sectoral reforms, but also started to identify reporting gaps for planning. We are now working very closely with the Bureau of Statistics on dashboards for gender gap assessment, youth development indices, to inform targeted programs with clear goals and contributions towards relevant SDGs. For achievement of the same, the Planning Commission works very closely with intersectoral partners and has launched some very important initiatives. SARS, a program that you are all must be familiar with, is Pakistan's biggest multi-sectoral poverty alleviation program, which has direct and indirect impact on several of the SDGs, as is reflected here. It is an important program which receives substantial funding for COVID-19 for cash transfer program, which benefited over 16.5 million of the population directly affected by it. Another important initiative is the State Youth Development Kamyab Jawan program, which is providing youth with stimulus packages, training, seed funding to support their businesses during this time of recession. The Youth Entrepreneurship Scheme aims to create and enable an enterprising group of young Pakistanis through provision of financing for setting up their businesses, create work opportunities and employabilities for others, and promote self-sustainability. There is a defined percentage of these loans to be provided to women. 2020 began as the year of nurses and midwives. We lobbied with the Ministry of Federal Education and the Higher Education Commission and succeeded in launching the first ever 1,000 scholarships for nurses. Alongside, we started working on migration of health workers. However, COVID-19 shaped our priorities for the later part of the years. Strategies and programs were introduced to combat the paucity of workforce with student forces, volunteers, temporary staff deputations, pandemic preparedness plans. Now with COVID-19, our new requirement is developing competencies for the points of entries, for disease surveillance and response, the public health lab networks that we are trying to establish, in addition to epidemiologists, virologists, intensivists, and critical care managers trainings. The Scholarships for Nurses program was to award 1,000 scholarships for bachelor's, master's, and PhD programs with a total value of over 1.3 billion rupees. I see that as having a far-reaching impact on several SDGs. SDG 1, as most of our nurses come from low socioeconomic backgrounds and they are able to transform their families. SDG 3, which is, as we all know, that nurses are critical to achieving universal health coverage. SDG 5 around gender equality, and SDG 10, which is around reducing inequalities. Strengthening of the human resource and the priorities and the way forward. I've listed some of the priorities, which include the development of a national HRH plan aligned to the forecasted need for the next 10 years, which I feel is critical. We are working on a health upgradation plan and are trying to link it to the human resource for health workforce plan. Mapping competencies and developing skill sets for competent workforce for strengthening the public health disease surveillance system for which monies have been dedicated. Meeting the nursing shortage through exploitation of virtual modes of learning for addressing the faculty shortage. Using IT for optimizing the available health workforce and enhancing the reach. Placements, on-job trainings, and mentorship programs are critical. Most important is improving quality of medical education through building partnerships in research and medical education. I would like to acknowledge the efforts of UpSign and our diaspora. Thank you so much for doing all that you're doing for the people of my country. You are indeed the flag bearers of Pakistan, and we count on you for promoting research and academic excellence through effective UK partnerships. Thank you so much.
Thank you, Dr. Shabnam. Very rightly explained and provided a very good overview, which gives us an understanding of what is happening in Pakistan at the moment. Can I please request everyone to keep posting on your questions in question and answers? And if you think your the question that you wanted to ask is already there, just click the like button so we know which questions are more common. You can also ask specific panelists, so you can name them and we will ask your questions later on from them. My next speaker is Professor Raisa Gul. Professor Raisa Gul is Dean of Faculty of Nursing and Midwifery in Shifa Tamilia Millat University, Islamabad. Dr. Gul has held various clinical and administrative positions in the past at Aga Khan Hospital, Shifa International Hospital, and Aga Khan University School of Nursing and Midwifery, Karachi. She completed her basic nursing and midwifery education from Lady Reading Hospital, Peshawar, followed by a post-RN BSc degree from McMaster University, Canada, and a master's degree in health administration from University of New South Wales, Australia, and doctorate from the University of Alberta, Canada, where she also completed her postdoctoral fellowship. She is a member of the Prime Minister's National Task Force on Health and a member of Islamabad Healthcare Regulatory Authority body and many other bodies actually. She has won various different awards, and the most standing one at the moment is that she is the recipient of Pride of Performance Award, President's Pride of Performance Award for this year, which is 2020. And I have had the privilege to be a student of Professor Raisa Gul, and I have learned a lot from her. So thank you, Professor Gul, for joining us today. And we would really like to hear your thoughts about healthcare workforce in Pakistan. Are we self-sufficient? Over to you.
Thank you, Parveen, for this very elaborative introduction. I'm really humbled and also pleased that you are hosting this forum. I would also like to thank you and all the UpSign team to organize this webinar and give us the opportunity to reflect what we have and what we may not have, and how the Pakistani diaspora abroad may help us. Let me apologize. Sorry, can you hear me?
Apologies. Would you mind switching your camera on?
Sure. I'm going to apologize and confess upfront that I will be a little candid in my comments and also in my reflection on the question that you have asked. Actually, it looks very simple, close-ended question, but before answering that, it requires processing several questions. And to some of which Dr. Shabnam also alluded with regards to nursing. But overall, you know, when we talk about the healthcare professionals, what do we mean by that? Who are we referring to? And you also refer to that to a certain extent. But I would say that, you know, it's usually dentists, medics, nurses, pharmacists, physiotherapists, and also other allied health personnel who provide a range of diagnostic, technical, therapeutic, and support services in connection with healthcare. The second question is, what do we mean by sufficient? Because sufficient, in my view, it's a relative term. And when we consider the demand of healthcare, we need to consider the sufficiency of healthcare professional, but also the health indicators, which at present seems to have a huge disease burden and double disease burden. And unlike the developed countries, we not have overcome the issues of communicable diseases, but we were also now equally confronted with non-communicable diseases. In fact, in my view, there is a continuous vicious cycle in which we are trapped because people usually talk of double disease, and I will say in Pakistan, I call it a triple one. You know, the terrorism and corruption and all the other social issues, which as earlier Parveen in her video were talking about the mental health, which is related to that, and it is continuously leading to further non-communicable issues. So then comes the third question, you know, when we talk of sufficiency, are we talking only of the quantity or the quality? And here is a table in which, you know, I would like to refer to. And if you look at the table, from my standard, it doesn't look very complete because, you know, I spent yesterday several hours, but for several information, which appears quite simple, but I had difficulty to gather it, you know. If we start with the dentists, in the table, if we look at that, you know, what is the current number in 2020, what is the recommended ratio, and what ratio do we have in Pakistan, and what is the deficit? So we look at the dentists, you clearly see a huge, you know, deficit in terms of numbers. If you look about the medical doctors, again, in that we are a bit surplus, you know, so that is something that, you know, maybe we can feel happy about it. So that is the area we are surplus. In nurses, already Dr. Shabnam spoke about it, huge deficit. Then it comes to midwives. So we have only about 38,000, and these midwives include both the lady visitors who have midwifery and also community midwifery. So there are different cadres of midwifery. And in total, we have that. I could not find any recommended ratio for midwives because it is usually based on the fertility rate and the healthcare facilities available in a country. But if we look at overall and look at our fertility and our healthcare facilities, apparently there is a huge deficit. For pharmacists, though the pharmacists have a council, but I could not find a total number of pharmacists which are registered with the council, but through an article, I was able to find that, you know, 46,000 at present. For the physiotherapists, we don't have even a regulatory council for them. And likewise, the challenge for allied health is even bigger, you know, because there are several people comes in that, and we don't have a council, though some work is being done at present to have a council for them, but it is not existing yet. So this is only about the number. So, you know, if we look at the data, we don't have sufficient data to base our planning on. And in terms of the quality, since I'm a nurse, I know more about nursing, I can speak with more confidence. But Dr. Shabnam is here, Dr. Bari is here, so, you know, they can speak more about it. I think in medicine also, you know, when it comes to quality, it may be better than nursing, but I'm sure there are, you know, several issues which need to be streamlined. The same is, I was able to speak to one of my colleagues who is a pharmacist by profession, and also take care of the physiotherapy discipline. And he also told me that, you know, they also have the same issue in terms of their education, but particularly the clinical placement of these people. So overall, we don't have only issue in the quantity, but also the quality of education that we have for our healthcare. And the clinical training is one of them. The quality of educator is also another issue. So after looking at, can you scroll down further, Parveen? And in journal, so by looking at all of that, the answer, if I say that no, now you will make, it will make sense for everyone that my answer to your close-ended question is no. But before saying this no, I have processed several, information reaching to this conclusion. And some of the key issue, I demonstrated it to you, the statistic issue, because that is the first thing, if we have clear statistic, we can make projection, we can have planning. And, planning is not based on, I will say, in needs. And again, I was able to demonstrate it to you that we have more doctors than nurses. We have lack of coherence in planning, preparation, and deployment of our healthcare professionals and their distribution into urban and rural areas. We also have lack of coordination in different constituency of the government. And I'm very sorry to say that for example, the Ministry of Health aims to improve the nurse-patient ratio, and Dr. Shabnam shared with us, several efforts. But very recently, the OEC, they have shipped the nurses abroad. We, instead of importing, we exported whatever we had, and naturally that will have implications. Our population growth, that is again a big hurdle, with whatever speed we work in all the area, we are defeated or we lag behind because, of the population growth. And then there are overlaps of roles, and the examples are, for example, LHV, FFP, CM. So there are several things, a lot of work needs to be done, before we call it that, yes, we are self-sufficient with regards to the numbers and quality of our healthcare force. So once again, thank you very much for this opportunity to speak at this forum. Thank you.
Thank you, Professor Gul, for an enlightening presentation and talking about various different issues that face our healthcare workforce and especially nursing workforce. And I think nursing is an important one. And if we had our next speaker, who was Mrs. Faria Habib, she was a nursing advisor. She works as a nursing advisor as well as nursing director for one of the hospitals. So her title was very interesting, and it was be on the table or on the menu. So women as healthcare workforce, we are more than 70%. We make more than 70% of the healthcare workforce globally. And 60% of that workforce, of the overall workforce, are nurses. So it's a very, very big number. And that's not only in Pakistan, but throughout the world. Having said that, we do not necessarily get a lot of opportunities to be on the, being leaders and to be able to share the concerns that people are having. So when policies are made with all the well wishes, with all the best information available, but people, when those people who are actually delivering the care or delivering the services at the grounds are not always represented at policy tables, we do not necessarily would be able to understand the issues which are affecting the healthcare workforce. And that's where it is important that we make sure that we look at those aspects clearly. We make sure that all different elements of healthcare workforce, be it nurses, be it doctors, be it midwives, or any other healthcare professionals, are equally represented and listened to, so that we can develop our healthcare work system in a way where people are able to contribute effectively within and outside country. So thank you so much for that. And I would continue to encourage participants to please keep on posting your questions, and we will have a look at the questions later on, and the panelists will be able to answer your questions going forward. So our next speaker is Professor Abdul Bari Khan, and I am really delighted to welcome him here. Thank you so much, Professor Bari, for joining us today and for giving us your time. He's the CEO of Indus Health Network and is also a consultant cardiac surgeon. And he is ex-professor and chairman of Department of Cardiac Surgery, Dow University Health Sciences, Dow Medical College and Civil Hospital, Karachi. We have changed the name of the civil hospital now to Woodfall Hospital, isn't it? So Dr. Bari graduated from Dow Medical College, Karachi in 1986. And then he completed his FCPS fellowship in cardiac surgery in 1995 and was commissioned as assistant professor of cardiac surgery in the year 1999. Dr. Bari has long history of community service and has been a motivator for social work. Apart from the remarkable academic achievement as a student and as a professional, Dr. Bari has also been involved in healthcare projects established for providing services to the poor and needy. And the list is too big, and I don't think I'll be able to talk about all those things. We'll be here for all the duration of this webinar. After completing his fellowship in cardiac surgery, Dr. Bari joined Civil Hospital Karachi as a cardiac surgeon, but without a cardiac surgery department. In a span of merely 2 years, he was able to raise 30.5 million from various donors and philanthropists. With this help, he was able to establish the Department of Cardiac Surgery at Dow Medical College and Civil Hospital, Karachi. This served as a model cardiac surgery ward for the country, providing free of cost cardiac surgery to people who were not able to afford. To date, this department has performed more than 4,000 cardiac surgeries, absolutely free of cost. Beyond Civil Hospital Karachi, Dr. Bari was interested by the Rufeda Foundation as the Chief Executive Officer for establishing the Indus Hospital located in the populous district of Korangi, Karachi. This began as a 150-bedded tertiary care hospital providing absolutely free specialized surgical and medical interventions. The one hospital in Karachi has now evolved. So welcome, Dr. Bari, and over to you. Dr. Bari is going to talk about, given his expertise and his work within the public and private partnership, he's going to enlighten us about public and private partnership and does that work to support healthcare system in Pakistan. Over to you. Could you unmute yourself, please?
Thank you, Parveen, for giving this opportunity. It is my privilege to introduce the Indus Health Network and its remarkable journey to what is now a countrywide Indus Health Network. From the very outset, I would like to say that at Indus, we believe that a robust health sector must include both public and private providers. Such partnership enables pooling of the expertise and resources for development, along with ensuring community outreach, access, and sustainability of health services to the most deserving members of the society. Unfortunately, health has yet to be a serious priority of those at the helm of power, resources, and decision-making in Pakistan. Resultantly, Pakistan is faced with a health emergency, if not a health catastrophe. It is with the above backdrop in 2007, the Indus Hospital was established in the urban slum of Korangi, Karachi. A 150-bedded state-of-art facility was Pakistan's first paperless hospital that provided quality healthcare to the underserved members of the community absolutely free. With the growing number of the patients of the community coming from across Pakistan, the Indus Health Hospital extended its services and transformed into a network of healthcare. Currently, the Indus Hospital and Health Network is running and managing 12 hospitals, more than 1,700 beds in total, 4 physical rehabilitation centers, 4 blood centers, primary health centers, and a large number of community-based public health programs across 60 districts of Pakistan. The Indus Health Network to date has impacted lives of millions with an unwavering aim to serve hundreds and millions more without charging a single rupee to the patient and the family. Now, the topic of today is a private-public partnership. Out of 12 hospitals, 8 are in a private-public partnership. 7 of them are in province of Punjab and 1 in province of Sindh. What are the challenges of private-public partnership? These are the lack of government commitment, poor risk management policies, poor banking policies, and unavailability of loans, poorly drafted regulatory and legal framework, inadequate mechanism to attract foreign investors and the local private sector participants, corruption and lack of transparency and competition. The vision is great. The higher authority wants the vision to get into the private-public partnership, but it doesn't trickle down to the lower cadre. So there are a lot of challenges. And what are the benefits from the private-public partnership? It provides better infrastructure solutions, results in faster project completion, and reduced delays on infrastructure projects by including time to competition as a measure of performance and therefore of profit. A public-private partnership returns on investment is greater than projects with traditional all-private or all-government fulfillment. Innovative design and financing approaches become available when the two entities work together. The operational and project execution risks are transferred from the government to the private participant, which usually has more experience in cost containment. Public-private partnership increases efficiency. By increasing the efficiency of the government investment, PPPs allow government funds to be redirected to other important socio-economic areas. The greater efficiency of PPPs reduces government budgets and budget deficit. High quality standards are better obtained and maintained throughout the life cycle of the project, which are done through PPPs. There are some disadvantages also. Every public-private partnership involves risks for the private participant who reasonably expect to be compensated for accepting those risks. This can increase government cost. When there are only a limited number of private entities that have the capability to complete a project, the relatively small field of bidder might means less competition and thus less cost-effective partnering. Profits of the projects can vary depending on the assumed risk, the level of competition, and the complexity and the scope of the project. If the expertise in the partnership lies heavily on the private side, the government is at an inherent disadvantage. For example, it might be unable to accurately assess the proposed cost. Actually, the private sector, as Shabnam rightly mentioned, that majority of the healthcare is taken care of the private sector. So there are strengths of both sectors, private sector, and there are weaknesses of both sectors. The private sector has the management skills. The public sector has the resources and the infrastructure. Now, there are few questions which arises, especially during the COVID-19 and private-public partnership. Question 1, what are some of the challenges faced and opportunities stemming from the COVID-19 pandemic from the private sector perspective? Resource constraint in the public sector in terms of financial, but more importantly, in terms of human and technical expertise. Majority of the PCR labs were in the private sector. The systems in the private sector, public sector of procurement was so lengthy that we would not have been possible to manage this pandemic if private sector would have not been in. Private sector also saw profit and revenue opportunities, and many private sector hospitals just randomly invested in equipment such as ventilators, for example, without having the trained staff and expertise to manage the same. Private sector was also faced with the challenge of the load that during the main spike of COVID-19 and had limited capacity to manage that in any coordinated way with the government. Overall lack of communication and coordination of the private sector with the government on treatment and patient care. Yes, data somewhat was shared, that too because government was very vigilantly following up on the front. Everyone wanted to jump on the opportunity in the private sector and created the menu of services, including testing, without realizing that such opportunism can result in misinformation and panic. Streamline private sector with higher capacity and those with existing government partnership, as well as those who were brought on the table by the government, clearly had a much better idea, not only about the management of COVID-19, but that of opportunities keeping the overall mission of stopping the pandemic from spreading. This proves that it's vital for public-private partnership and public-private communication and coordination to exist with or without pandemic for both sectors. To have a clear sense and idea about each other's strengths and weaknesses. To me, this is the most important takeaway from the pandemic. And thus, with running partnerships with the provincial government and a seat on the Prime Minister Task Force, was able to contribute enormously on a variety of tasks which otherwise would have been a challenge for the government. The other two questions, how the future public-private partnership is evolving in Pakistan, given that this pandemic has really brought on surface the need of a strong partnership. The other question, do you think that current pandemic control has to do with public-private partnership? This has to be taken as the biggest opportunity, and if not financial, at least communication and sharing of knowledge and expertise. Both these public-private partnership must be immediately created where they do not exist, strengthened where they already exist with a short-term, mid-term, and long-term preparation for any other such pandemic, and more importantly, to build on this experience for overall health sector management through public-private partnerships and also public-public partnership. This pandemic to me has clearly proven that private sector and government must come together to forge partnership to have any chance of managing the health challenges of Pakistan. To me, it's crystal clear that the government alone would have had no chance of managing this pandemic. Yes, the private sector at times acted for profit and financial gain, but large private and charity-based private sector especially step up to help the cause, and government only tapped into a handful of such initiatives for leveraging the impact. The canvas of the issues emanating from the pandemic was huge, and several areas of health had nothing to do with the health, or at best indirectly, hardcore health issues, for example, livelihood support. The private and charity-based private sector also help in awareness raising at a mass level, and especially on digital platform. And if there were public-private partnership for that too, it would have been far more impactful than it had been. Thank you.
Thank you so much, Professor Bari, and that has been really useful, especially with regards to understanding what different opportunities are available between public and private partnership, and knowing that quite a lot of our healthcare workers from Pakistan also work in other countries and are really very much interested in supporting organizations in Pakistan. So understanding this is greatly appreciated and would help those people to think a little bit more about the options and who to ask for when it needs advice, because quite a lot of the time people cannot take initiative because they don't know where to start or where to go and who to ask for the right advice. So I think this has been really very, very useful, and I'm looking forward to the questions that people are going to ask. So thank you so much for that. Last but not the least, and though Mike did bribe me, but the bribe money was too small and it didn't go to my account, so Mike gets to be the last speaker. So our last speaker is Mike, and I will struggle to pronounce the last name, so apologies with that. So it's Nithawarinkis. So Mike is Britain's Deputy High Commissioner in Karachi, and he's also Trade Director for Pakistan. His career as a diplomat started in 1980s when he joined Foreign and Commonwealth Office. He has had positions and postings in Malaysia, Russia, Ghana, Saudi Arabia, and Greece. And more recently, he has been a Deputy High Commissioner in Chennai and Deputy Ambassador in Kabul. He has also spent a period of sabbatical from the Foreign Service, gaining experience in the private sector. And several of Mike's roles have focused on international security, regional politics, and supporting bilateral trade and investment priorities. And this is what he's doing at the moment with us as well, where we are trying to see how in various different disciplines, as you know, as Upsign, we are a multidisciplinary organization. So we not only talk about health, but agriculture, food security, energy, and you name it, and different fields are there. So we are trying to see how can we exploit the potential of Pakistanis and British Pakistanis to be able to come up with sustainable and effective projects. Mike today is going to talk about opportunities for ambitious healthcare partnerships between UK and Pakistan, and what is it that can be done or can be offered or can be explored to increase the potential among the healthcare workforce for the benefit of both of these countries. Mike, over to you. And thank you for joining us, and apologies for messing up with your name and having you as the last speaker.
Parveen, thank you very much. I'm not able to switch my video on because I don't seem to be able to have the ability to do that. Not that I'm bothered about you seeing me, but if the host or the Jawad can, I'd be happy to have that happen. So look, thank you very much indeed, Parveen.
Mike,
I'm really,
yes. Can you make him a co-host and he'll be on?
I need to make myself a co-host,
no,
do I?
Parveen as the host needs to make you the co-host.
Okay.
Done that.
Can you do that?
Done that.
You should be good, Mike.
Yes, there we are. So greetings from Karachi, everybody. And Parveen, thank you very much for the lovely, warm introduction. The bad news is that you get a score of 2 out of 10 for pronouncing my surname. So I'll give you some lessons on that when we next meet. But otherwise, I am really very happy to be here, and congratulations to Parveen, to Upsign for this series of seminars that looks really fascinating. The High Commissioner and I are really thrilled to be participating, and I know that there are other colleagues of mine from the UK and Pakistan network who are online, either from Karachi or from Islamabad. So welcome to them and to such a diverse group of people. I can see from the questions and the comments in the chat bar that there is a really active and engaged audience. So I hope you have delayed your afternoon siesta to listen to my final remarks. So as Parveen says, I am the Deputy High Commissioner here in Karachi. That's my Foreign Office role, where I'm responsible for these relations with Sindh and Balochistan. And I'm also, for our Trade Ministry, the Trade Director for all of Pakistan. And so it's a mixed role. And my engagement with Upsign started way back in June 2019, before I even got to Karachi, where I was able to attend, I think it was an annual event then at UCL that Jawad was the host of. And although I was not able to attend any of the seminars that Upsign ran in Islamabad in March, I was at the meeting that the High Commissioner referred to in his introduction, that Jawad and Itisham and Khalid were at. And that gave us a sense of energy from Upsign and excitement about the potential in the relationship, because we could see that Upsign clearly had an ability to leverage fantastic knowledge and networks and expertise to deliver a range of excellent services and knowledge transfer in Pakistan. Unfortunately, obviously, the COVID pandemic has slightly interrupted things, although it hasn't slowed Upsign down. And I'm delighted to say that on this particular element, on healthcare and on healthcare partnerships, it's probably been one of the more active parts, at least as far as I'm concerned. And I'm really pleased to be involved in that. For the UK and Pakistan, not just because of COVID, although because we've had a long-standing interest in the healthcare sector, usually through DFID, the Department for International Development, as was. But COVID, if anything, has accelerated that interest, partly because of the wish to support Pakistan in its response to the first wave and now during the second wave. But if anything, it has underlined to us that the linkages between our two countries mean that the healthcare sector is absolutely uniquely placed to be an area where we can develop a huge number of partnerships. And I really think we should not hold back on the ambition to do that. And the High Commissioner mentioned his 3 Ps of partnership, perception and potential. I just wanted to touch on those for a moment, because I think they really underline the scope to do some exciting projects in Pakistan. And I'll touch on what I think those might be towards the end of my remarks. So firstly, everybody recognises that the historical links that our two countries have mean that, of course, the diaspora is going to be an element that we want to exploit in a very good way. And I don't think, frankly, the British government's efforts in Pakistan, it's not that we've neglected it, but it was just that we've not focused so much on the leverage that the diaspora at the UK end could bring to the relationship. And so you know as well as I do that there are something like 1.6 million British people of Pakistani origin, straddling all areas of society, politics, business, civil society, academia, sport, journalism. And we, the UK in Pakistan, would like to not formalise, but just find more ways of doing the sorts of things that Upsign has off its own back decided to engage in. And that really was what lay at the heart of the discussion that we had with the High Commissioner in March, and which I hope is something that we will be able to return to quite soon. So, these multiple existing links, many of them informal, where I know that people from Upsign have partnerships. Usually it could be one researcher in a British university aligning with a researcher in a Pakistani university, doing something that may not even require funding. It's just an agreement between the two faculties that they should do something where there's mutual interest in doing that. And those are fantastic because they can build trust and confidence and grow over time. So those kind of incremental opportunities definitely exist. But I think we in the government would like to find ways of trying to help grow and intensify those sorts of partnerships, and maybe be a little bit more ambitious at the outset in some of them. And I think now is the time to be focusing on that. So, firstly on the partnership, you are the living bridge between the two countries, and where I have an interest, of course, in helping UK entities do partnerships in Pakistan on a commercial basis. The wider team in Pakistan is obviously interested in knowledge transfer, philanthropic ventures, where of course Pakistan leads the world in that space, particularly in healthcare and education, which touches on both elements of what we are talking about today. So I hope that we can be increasingly more responsive and structured in how we might engage and maybe facilitate and be a sort of convening power, if you like, to try and bring some of those informal linkages further on faster. So that's partnership. On perceptions, again, as well as I do that the perception of Pakistan can often be one that is outdated in the UK and elsewhere in the world. It can be ignorant of the recent facts. And, just look at this city in Karachi of 25 million plus people, where several years ago it had a really awful reputation for violent crime, terrorism, and it really put off a lot of people from coming to Karachi. The strides that have been taken in this city, but elsewhere in the country, to significantly reduce violence has been extraordinary, and it really, the credit and the sacrifices go to the Pakistani system, the people, and of course it's not it's not to say that it has been wiped out completely, but it's a very much a trend that is heading in the right direction. Something like an 80% reduction in incidents over the last 5 years, and we see that in terms of the things that have happened just in the time that I've been in Pakistan, such as the visit to Pakistan by their Royal Highnesses, the Duke and the Duchess of Cambridge, a fantastic visit last October that really helped to put internationally the country on the map. It allowed us to change our travel advice, which has opened up the north of Pakistan, the beautiful north of Pakistan, to many more British tourists. I'm sure when we get past the worst on COVID, those numbers will increase significantly. British Airways returned their flights to Islamabad in 2019 for the first time in 10 years. Since then, they've increased their flights to daily flights. They've gone to Lahore. As of next month, Virgin Atlantic will be flying to to Islamabad and Lahore, and that will mean that there will be 21 direct flights a week by British Airlines from the UK to Pakistan, which is really good. You know, the MCC came to Pakistan in 2020. The England cricket team will play in Karachi in October 2021. You know, these are all really positive elements that reinforce the message that Pakistan is open, hospitable, largely safe, and ready for initiatives like those being suggested by Upsign to really take off. So that's the sort of perception where I hope over time we can address some of the outdated perceptions of Pakistan. And then the potential, I think, is really significant. We all know that COVID has caused problems not just with the healthcare challenges, but the economic and the livelihoods impact. Even countries that may have got off lightly in the first wave or during COVID in 2020, the secondary impacts are going to be really very significant. And so, you know, the economic stability issue is a big one. Just look at the impact in the UK, where our economy will declined by 11.3% in 2020. That's the largest hit to our economy in 300 years. And although Pakistan has fared less badly, Pakistan will enter recession for the first time since independence. So, you know, these are really big seismic jolts to our economy. And so the sooner we can get back to investment and focus on public services like healthcare and education, you know, the better. And I think we are going to have to be very innovative in how we do that. If we look at the comments and questions in the chat bar and the Q&A, there's a lot around healthcare technology. There's a lot around blended learning, because we can't afford to just deliver face-to-face learning across the board, irrespective of whether there are infectious diseases like and pandemics around like COVID-19. So I think we are looking to innovations through academics in Britain and Pakistan to be able to come up with a model that reduces the cost of learning, because certainly we will not be able to train those healthcare practitioners, those clinicians, those nurses in large numbers just by doing it through the traditional medium of people going to classroom-based learning. And I do think we need to have that very much as part of the higher education offer. We've been working on a very big nurse training initiative in Pakistan, which I hope that Upsign will be very much a part of. And essentially that is around significantly increasing the number of undergraduate nurses trained in Pakistan, and where we might find UK faculty being a part of the solution, particularly when we consider that there are so many UK faculty of Pakistani origin who would have not just the ability to deliver a high-end UK curriculum, but understand how to do things in a culture like Pakistan's with the language skills to go with it. And so I hope that is something that we are going to be able to look at. It may be a discrete direct Upsign initiative that I'm talking to Parveen and Jawad and others about. It may be as part of a much broader, more ambitious set of initiatives where we talk to the government of Pakistan at the national federal level, but also at the provincial level in places like Sindh and Punjab, and where we can hopefully bring in, which brings me really to some of the helpful comments that Professor Barry was making about the sort of public-private partnerships, where we can identify public sector entities where there are existing nursing college seats, but maybe expand those and attach UK trained faculty to those institutions, but that we can also look at developing the same system for private sector entities where increasing numbers of people who have the ability to pay fees, even if they have to be subsidised, could attend those colleges. When one looks at the demand for nursing seats, hopefully that is sufficiently strong and the pipeline is strong enough to be able to add more opportunities to that. And I would go beyond just the nursing focus. I mean, we would be interested in looking at some specific specialties around cancer, mental health, diabetes, infectious diseases. We would also like to bring in more UK medical Royal Colleges. It's very striking that the Federation of Royal Colleges of Physicians of London and of England and Glasgow and Edinburgh visited Rawalpindi and did face-to-face examinations for the first time in a long time just last month. And I think Upsign could play a really useful role in being, I won't say part of a consortium, but just part of a combined effort to look at some of those aspects. Now, the question arises as to how we might have the entities there that can deliver that. Will it need some government-to-government strategy or umbrella agreement to help drive it forward? And that is something that we are discussing with the Ministry of National Health, and that we would like to bring the UK's Department of Health and Social Care into the conversation on, Universities UK International, Health Education England. You know, there are all sorts of questions arising about, if we are doing workforce planning in Pakistan, do we want any of those people that are being trained to get an opportunity to work in the UK for a few years to be able to hopefully plug gaps in the UK workforce planning system, but then come back to Pakistan and be, you know, to be able to offer their services at an enhanced level? We need to be slightly careful, obviously, because we are not wanting to encourage the brain drain in Pakistan and lead to training of people in Pakistan, and then we lose them to other countries, not just the UK, but the Gulf or elsewhere in OECD countries. So that needs a bit more thought given to it, but it's certainly something that is actively being pursued. And I think within the UK team in Pakistan, we see this as being a focus not just of the Foreign, Commonwealth and Development Office. So for those of you who don't know, the Foreign and Commonwealth Office and the Department for International Development merged on the 2nd of September. So we are now FCDO. So there's FCDO, there's the Department for International Trade, which looks at helping UK entities on a commercial basis. And then, of course, there's the British Council that does a huge amount in higher education and in examinations and English language training. And I think we could probably put together a small working group within the UK team in Pakistan to engage on this. So look, in conclusion, what can I say about what Upsign can do to maximise its potential and impact on all of this? Personally, I hope we can leverage this fantastic knowledge and expertise that you represent to deliver an ambitious workforce planning project in Pakistan. I mean, as I've said, nurse training is something that, you know, we hope we can push forward, but I think there is scope to go much, much more widely. The funding is going to be an element, whether it is paid for by a government entity, whether we raise money through grants, or whether we put the burden of payment on the end provider, either the private entity or the student, is something that we need to obviously actively work out. And it may be that it is a combination of all of those factors. But I hope, as the High Commissioner made clear in his message, and I've tried to through my remarks and obviously with my interactions with Parveen and Jawed, that the UK could, we hope, be a facilitator to all this, and that Upsign is, you know, has the potential to be this fantastic multiplier at the centre of all this, you know, supporting deeper healthcare engagement between our two nations. And in terms of next steps, you know, I think we need to work with Upsign to advance their proposals to help upskill Pakistan's existing nurses, but also train greater numbers of nurse undergraduates. I think undergraduate level is the key. And I'm really hopeful that the experience of organisations like Upsign will enable greater levels of engagement with UK entities entering Pakistan. And I hope we can do, what we can do is bring the sort of high level support and input to bring the UK and Pakistan official government entities behind the project to get it off the ground. Because we know that, you know, when it comes to bureaucracy, well, you know, the British are the ones who invented it, but, you know, in Pakistan, they've taken it to an altogether higher level. So we need to be able to penetrate that in a way that, you know, brings us moving forward in a concerted way to deliver what I hope will be a really good outcome. And I'm quite excited about what 2021 presents to us in that sphere. Congratulations again to everybody who has organised this. Thank you very much to everyone for listening, and I hope we'll have a chance to engage during question and answer and after this series of seminars is over. Thanks very much.
Thank you, Mike, and apologies for failing miserably in pronouncing your name, and would really appreciate some lessons. So thank you so much for that. And I think all of these things, I think one thing which I feel is that throughout this discussion, we've talked about development of the healthcare workforce. One of the element which we probably haven't really focused that much, and I would like to take this opportunity because Dr. Shabnam is here, Dr. Bari is here, yourself, and Professor Raisa, and you all have got very important role at various different levels, and you all sit in very influential positions. I think one of the biggest problems is that it's not about only the development of the workforce. And if you see, we do develop workforce, but the problem is that when you do not develop career structures, and you do not develop the pathways for the workforce, which enables them to work effectively into their positions and which provides them with some kind of job satisfaction, life satisfaction, enables them to meet the needs of themselves and their family members and feel respected, that is missing. And I think that is something, if we could try and develop at various different levels, that would be an extremely important aspect, an extremely important achievement supporting healthcare workforce in Pakistan. So thank you so much for that. With regards to developing people who can work within and across the country, I think sometimes it is seen as a brain drain. To a certain extent it is, and therefore we need to have a careful planning. But then at the same time, if you meet the needs of the people, that's what makes a difference. And at the end of the day, people do return back to their roots and do try and fulfill or do try and fill the gaps wherever they can, like we are doing, like all of us at Upsign are doing. What we are doing is we're bringing up Pakistani, British Pakistani people with Pakistani origin, people in Pakistan, to bring together to come up with these bigger ideas to solve issues that are affecting our system. So thank you ever so much. And we have stayed on time, which is good. The only problem is that we have got very less time for question and answers, which is fine. But I would like to take this opportunity to ask Jawad to please share the video from Dr. Faisal Sultan, who was expecting to be here with us in this event, but couldn't do so. And therefore, he has shared a video message with us. I promise it's very small. It's only about 1.5 minutes or so, so it's not going to take long. And we will take your questions then. Over to you, Jawad.
Okay. Can you see that?
Yeah.
Okay.
Assalamu alaikum. Ladies and gentlemen and Upsign colleagues, I'm pleased to be here today to support the work of Upsign and how they are helping to link the scientific research and academic communities from the United Kingdom with the Pakistani counterparts and those that make policies. I apologize for not being able to attend this in person, but I welcome Upsign and their work towards greater collaboration around initiatives between key stakeholders from both the UK and Pakistan in the domains of health and science, as well as education. I'm delighted to send this message, wishing Upsign and its partners the best of luck towards organizing this annual conference, which is being held virtually this year. I look forward to receiving the recommendations of the conference, and my ministry and my colleagues will be available to support relevant opportunities for bilateral United Kingdom-Pakistan initiatives and cooperation in these areas. I would like to thank you all for the contribution that you have made so far and that you intend to make in building a better future for communities across these two countries. My best wishes to you for today and for your work. Thank you.
Thank you, Jawad. And if panelists are okay to put the videos on, we will try and take a few questions which people have put up in question and answer sections. If we are not able to answer all the questions, which I'm sure we will be able to, I will try and find a way of getting back to you with these questions, perhaps through another event or through writing to you, whatever works better, if that's okay. So our first question is, well, people keep on liking, so the question listing has shifted a little bit. Dr. Zafar Iqbal is asking, so the question is, how do we build a public health workforce and public health systems to meet future challenges? And that's the question to you, Dr. Shabnam. What I understand is how can people, especially, we have got quite a lot of big workforce who is working as public health professionals in the UK. And there are many people who are working in public health in Pakistan and interested in developing public health, academia and public health research in Pakistan, which includes various different healthcare professionals. So what do you think, how can we build those networks and how could we build those systems to meet future challenges?
Thank you so much, Parveen. This is such an important...
You're mute.
Thank you, Parveen. This is such an important topic, and this is something which is on the priority with the government. And I think COVID-19 is giving us an opportunity to bring the public health, give its due recognition and make the necessary investments, which we had been advocating for years. We have dedicated in the federal government, health is a devolved subject. So we have dedicated around 70 billion for this year for COVID-19 to help the provinces with their different programs around mitigating the impacts of COVID-19. Together with the provinces, we identified 4 priorities, and one of the priorities is strengthening the public health disease surveillance mechanisms. So today we had a presentation from one of the subcomponents of that, the technical working group, which is working on it, which was around the points of entry. Alongside, we are very conscious that we need to map out the competencies and the skill sets which are essential for us to have an enabled public health workforce in place for all these system structures that we are hoping to fund under this program. So without doing an alongside workforce plan, a public health workforce plan, particularly focusing on the disease surveillance elements, is critical for the success of this reform. So I think this brings in a lot of opportunity for collaboration between UK universities. In my previous role, I had been working very closely with Public Health England, and I think they have one of the richest resources available for guiding other countries in terms of planning. Some of their documents are absolutely fantastic. So I think we will continue to explore opportunities where we can benefit from these established public health systems and workforce development plans. And we would want to institutionalize these trainings and then offer them across to the entire country. Because this is the disease surveillance. I think COVID has just taught us that doing it in one province, a bigger province or a more stronger province would not help us control these epidemics unless we take care of we move all the wheels together. So we are very, very open to and very interested in exploring partnerships in this context as well.
Thank you, Dr. Shabnam. That's really useful. Just a quick question again from yourself, but I would appreciate if you could just quickly do it because there are, I could see some other questions. How do you see hospitals and healthcare sector's capacity being improved in COVID-19 time?
The second initiative, I've talked about the first one. Out of the 4 priorities, the first initiative was a health upgradation plan. So we undertook a facility assessment across all the tertiary care, all the DHQs and THQs across all the districts of Pakistan, and we were able to identify where there are glaring gaps in offering critical care and infectious disease management. Almost 50% of the funding within this PSTP program for COVID-19 is dedicated towards upgradation of health facilities across Pakistan. And we are now working with the provinces and guided by this facility assessment that we had done in upgrading the public health facilities across all these districts so that people are able to get the first level of care within their district, when in critical care scenarios.
Okay. Thank you ever so much. My next question is to Professor Raisa Gul. There was a question which has just disappeared. And I think Professor Gul also wanted to respond or add into Mike's points that discussed earlier. So Professor Gul, the question is, how do you see, no, sorry, that's not. What are the three main challenges in Pakistan to recruit and retain nurses from your perspective? And so please come on. I'm just conscious that we have only got, we decided to finish at 11. So I think we are going to go a little bit over time, but let's make sure that it's not too much because people may have other commitments. So please, everyone, if we can be brief with our answers. Professor Gul, over to you. Thank you.
Thank you, Parveen. I think with regards to challenges, one of the things you have already alluded to, the lack of career structure. I will also say enabling environment and opportunities for higher education. And enabling environment covers several things, the element of respect and, you know, several other things. But what I would like to use this time particularly, I would really like to thank Mike for his very specific let's say comment with regards to nursing and how, you know, the willingness to help nursing. Nursing shortage is an international phenomena, and Pakistan has a lot of capacity. I mean, we have a lot of young population, and I also see a big change where people are willing to come forward for nursing with the introduction of the degree program. But as you said correctly, that, you know, our big issue is the number of educators. And I think COVID has, while it, you know, it has affected us in a negative way, in several ways, one of the positive thing is that, you know, it also brought some opportunities. So one opportunity is that our Higher Education Commission in Pakistan was very suspicious, I could say. I don't know if it is the right word or not, or very, you know, cautious about, you know, offering online education. But I think with the arrival of COVID, I think now I do see more openness, or even rather suggestion to go online. So I think with that, I will say specifically, if we want to enhance the production of nurses, one thing or one area where we are repeatedly saying help with educators. And there are two areas. One is the specific, it could be courses, but more so with regards to research supervision in the master's level students. So this could be research supervision and examination. And again, I will not go into many detail, but the next point which I'm going to make it, that I would really like, and I'm seeing some people opting for that, you know, they have this thing and they would like to help. I think to what we need to do for the upsign, my suggestion will be that if we could create a database, and it shall have two key parts. One is who is available from Pakistani diaspora over there, what are their expertise, how long and in which area they desire to help. On the other hand, we should also create that awareness that in nursing institution, what kind of help exactly do they need? So if we have this kind of database and maybe some formal support for the upsign who could facilitate that kind of partnership and match. And just, you know, my last comment, I will say that, you know, we could learn in that regard from one of the help which is offered at Aga Khan University, where, you know, it's called TKN, Time and Knowledge Nazrana, where people from abroad are, you know, they offer themselves that where they would like to help Pakistani institution. And likewise, so, you know, so there is a forum which kind of facilitate that partnership, you could say, or that matching, that, you know, who is available to help and where and what kind of help is needed from Pakistan. So I'm just bringing that is there. I'm also very willing to help further in that how to formalize that kind of arrangement. Parveen, we can take it after that so other can, comment. But all the suggestions that you have are very welcomed, and thank you so much for that.
Thank you, Professor Gul. I will ask Mike to respond, and I think Jawad has something to say. Just to mention that we did initiate that. So we do, I mean, you've seen it, the kind of stuff which I've done in past sometime, especially in last year or so, to uplift and to help people with research, especially with regards to research knowledge, etc. And also what I have done is working with Yarane Watan, so the kind of database that you've mentioned. So, got nursing into it. So when Yarane Watan established, it was all purely medical focus. So it was myself speaking to them and tried to make them think and change the structure in terms of people from outside Pakistan suggesting what is it that they would like to offer. Having said that, the information, especially from within the Pakistan about nursing related aspects and where people need help is missing, mainly because many hospitals are managed and directed by medics or managers, and nurses may not always be on the tables, on the decision making tables in smaller hospitals to bigger organizations, and which is then affecting Yarane Watan to bring up those expertise and those hospitals to say anything about nursing, that what is it that nurses would need. So that's one thing if probably we can work together. Mike, do you want to add anything to it? Apologies, I'm just rushing it because I'm just conscious of the time.
No, you're covering it really well, Parveen. It's good to hear from the panelists. Just very quickly to say, I do think that all of the ingredients are in place for us to be able to put together a group that could do a lot. We just need to be very sensible in how we approach it, because what we don't want to end up is with unwieldy large committees and working groups where we end up having talking shops but don't actually achieve the outcomes that we all desire. So I'm really pleased that Dr. Faisal gave a message at the end there, because we know that he is personally passionate about this particular issue on nurse training. And I think we feel that we've got the right individuals in place who know exactly how to bring the two parts together. It's just taking that first step. Ordinarily, we would say in a country like Pakistan, let us do something modest to begin with and build it in terms of scale. But what we can't do is something that's so small that doesn't, may have a tiny impact at a local level, but doesn't actually do much to address the wider problem. So I think you need to work out the strategic focus and then work backwards from there about how we try and deliver that. And that is what the next stage. I have a discussion with the Ministry of National Health tomorrow with one of Dr. Faisal's advisors, who was at the meeting that the High Commissioner and I had with him, and do a discussion with Upsign about the proposition that they put forward. And I hope, given the messages that we've had from the participants today, I hope, there seems to be no shortage of people who are expert potential contributors. We just need to work out the best way to harness that knowledge to reach the outcome that we all want.
Thank you, Mike. Jawad, I saw you had a hand raised.
So as the chairman of Upsign, what I want to just get across is Parveen is our key person. She has trained at the highest level in nursing in Pakistan. And I think if you can all direct Parveen as a central link person, I know Mike is connected with Parveen. I know all of you have connections. And Parveen also has connections with the UK diaspora, the medics and that. So she is the key person, and inshallah we will take this initiative forward in a pilot project at least. And so we really need all of the experts and some of the people who are offering support. Please get in contact. So that was just my thing on a high level. Professor Raisa, your idea about the network, I actually proposed this more than 2 or 3 years ago across the whole of academia. And I'm not going to mention names of people, but you can guess the organizations that I talked to about this. And there was a lot of yes, we'll do it, and nothing happened. So we are still chasing the idea, because if you want to referee a grant, if you want someone to do a PhD Viva, if you want someone as a contact person, across all of academia, we should have this knowledge of who is in the UK, what expertise. There are many diaspora volunteers who want to give up their time. Unfortunately, we are a network, and that started the process, but we actually do need to have a sort of a database, I'll call it. You can guess who we approached. And, we'd like to formalize this in a way that we don't have to be involved, but we could help to facilitate. So in nursing, I think this is a great way to start. And, let's try and grow it. But believe me, this is such a great idea. I wish people would take us up on it. So thank you so much. And I just want to congratulate all of you today on an absolutely fantastic event. I stayed and listened to all of it, and I think it's been amazing, and I'm so impressed. And thank you very much.
Thank you, Professor Jawad. My last question, there are lots of questions, and if we tried answering it, we'll be here for another hour, so my apologies. But I would like to ask this question from Professor Bari. One of the questions which is being raised by one of the participants is that how do you see the role of philanthropists in health sector during COVID-19, and how this can be improved?
A lot of philanthropists has contributed to COVID-19, be it social support in the medicines, PPEs, and one other opportunity which came out, lot of the things which we were importing from outside, and there was logistics problem, people have started manufacturing in Pakistan. So now we are exporting PPEs to other countries now. It is, I think so, apart from the government, which they have invested into it, the philanthropist has done twice as much than the government, which have contributed to this pandemic.
Thank you, Professor Bari. Thank you, everybody, for a really useful discussion. And I completely agree that having a data or knowing people and having a network does really help. And that's what has happened with Upsign. As a British Pakistani academic, I never knew how many academics of Pakistani origin or otherwise exist in different UK universities, and how could one of the things we used to struggle was how do we actually connect with institutions in Pakistan on different research projects. And with Upsign Network, what we learned, the breadth and the depth of the knowledge and people working across different sectors, and tapping into it, and that's been a great resource. Similarly, we have got separate groups for public health professionals. We have got separate organizations for medics. For example, Apne is a good organization. Another one which I'm part of is Sharp, and quite a few other things. So it's the grouping, when they come together, we are able to do quite a lot. So thank you ever so much for a very useful contribution. I hope it was useful for all of you. Apologies for not being able to ask a lot of questions that people have posed. As I say, we'll try and come up with some kind, I'm not promising, but I'll try and come up with some kind of strategies to come back with answers. I'm just conscious that we've taken 10 minutes more than what was intended. So thank you ever so much. Thank you so much to the panelists. Thank you so much, Jawad, and everybody else who attended us today. Please do give us your feedback. And Farzana, if you were able to share the link for the certificate. If people wanted certificate, Farzana is going to share a link, or so just type your name and we will know who attended and we'll be able to post that to you. Thank you, everybody. And I look forward to working with you all. Allah Hafiz.